Welcome to today's video, which is on Helicobacter pylori, otherwise known as H. pylori. So this is a spiral-shaped gram-negative bacterium which lives in the lining of the human stomach. It was discovered in 1982 by Barry Marshall and Robin Warren, who won a Nobel Prize for their groundbreaking work. So how does H. pylori survive the stomach? So despite the stomach's acidity, H. pylori survives by producing an enzyme called urease, which breaks down urea to create ammonia and neutralize the acid around it. It also burrows into the stomach's mucus layer, helping it avoid destruction by stomach acid immune cells. So this spreads by fecal to oral transmission, contaminated food, water, utensils, and is often acquired in childhood. So firstly, it spreads through contaminated food or water and by oral contact. Most people are infected in childhood, especially in areas with poor sanitation or crowded living conditions. So many individuals with H. pylori have no symptoms. When symptoms do appear, they can include abdominal pain, bloating, nausea, or even vomiting. It is also a leading cause of chronic gastritis and peptic ulcers. So if left untreated, H. pylori can cause serious complications. These include peptic ulcers, gastric cancer, and a rare type of stomach cancer known as multiple lymphoma. Doctors can diagnose H. pylori using a few different methods. The urea breath test is non-invasive and is highly accurate. Stool antigen tests and endoscopy with a biopsy are also commonly used depending on the situation. So treatment of H. pylori involves using the triple therapy, which includes 2 antibiotics and a proton pump inhibitor to reduce stomach acid. Sometimes a bismuth compound is added, forming quadruple therapy. Treatment usually lasts between 10 to 14 days. So in summary, H. pylori is a common infection, but it's also a major cause of ulcers and gastric cancer. Understanding how it spreads, how to diagnose it, and how to treat it helps prevent long-term complications. So thank you for watching. If you found this helpful, hit that like button and subscribe for more microbiology topics made simple. Leave a comment if you have any questions and stay tuned for our next microbial deep dive.